Hello, everyone.
Hello.
Welcome. As you're joining, if you haven't already completed the pre-evaluation, please go ahead and do that while we wait for others to join. The link was emailed to you this morning. It's also here on my slide. If I find my chat button, I can also put it in the chat for you. There you go. And then if you also don't mind, once you're finished with the eval, just to introduce yourself in the chat, adding your name, your organization, and what your cancer focus is. Veronica, I'm going to make you co-host to help me with the waiting room.
Will do.
Thank you.
Okay.
Okay. I think we're going to go ahead and get started. If you still need to introduce yourself, feel free to add it to the chat as we go. And make sure to complete that pre-evaluation survey. So welcome everyone to the first part of our community grant writing workshop. This training was adapted from the Putting Public Health Evidence in Action training that was developed by the Cancer Prevention and Control Research Network, which is funded over the years by the CDC and the NCI. And this training also builds upon the sources that are listed on this slide. Before we dive into the training, I also wanted to alert you all to the funding opportunity that we have coming up and that's kind of the focus of this training. So the UNC Lineberger Office of Community Outreach and Engagement is offering funding of up to $20,000 for you to plan or implement evidence-based interventions for cancer screening in your community. Applicants must demonstrate the ability to independently or in partnership with clinical organizations plan or implement an entire scope of a cancer screening. And the letters of intent are due at the end of the month on July 31st, and the proposals are due September 18th. If you have any questions after this session, feel free to contact me or Veronica Carlisle, whose email is there on the slide. So a bit of an overview about what we're going to cover today and next week. Today is part one, and we're going to start out with some just general grant writing tips. Then we're also going to dive deeper into sections that are on the RFA and talk a little bit about tips and tricks and different things that you can do in preparing those sections. So there's the project overview. We'll talk about the background and significance, engaging partners, selecting your evidence-based interventions, and then we'll end with writing your SMART objectives. In the second part of the training, we're going to talk about the project plan and timeline, as well as the evaluation and sustainment plan. And then we'll also chat a little bit about how to write a budget, including the resources that you'll need, and conclude with a summary. New this year, we're also going to offer some post-award trainings for those who are funded. So in these trainings, we're going to dive deeper into evidence-based interventions than we are going to today. Tier 1, the people who apply to the Tier 1 are still kind of planning and thinking about what their evidence-based intervention might be. So we are suggesting that those who are funded in that tier attend our finding and selecting, as well as our adapting evidence-based intervention trainings. And then in tier 2, we'll have ones focused more on implementing, evaluating, and sustaining your EBIs, as that the tier 2 will be a little bit further along and ready to implement. All of this will probably make more sense too once you are able to read the full RFA. So getting started, I wanted to provide just some general grant writing tips. These will apply not only to this proposal, but any others that you might want to write. They might be a little obvious, but I want to make sure we're kind of all on the same page. The first is to know your funder. So you want to read the funding announcement thoroughly, and you want to make sure you understand the funder's priorities, any eligibility criteria, and what allowable expenses are. And you want to be able to tailor your proposal to align with the funder's goals. So in this case, we're hoping to see a proposal that's focused on cancer screening. That's the priority for this proposal, but there may be different ones for different funders. The second tip is to follow the instructions exactly. So if there's any instructions about formatting or page limits or required sections, make sure you follow that carefully. You also want to use any provided templates or forms if applicable. We don't have a lot of restrictions like that in our proposal, but some might, or some requests for proposals might. Thirdly, you want to make sure that you write clearly and briefly define any medical or technical terms so that the reviewers know what you're talking about. When writing, try to use active voice and strong verbs. For example, say, we will partner with local churches to host screening events, rather than screening events may be hosted. Of course, you want to proofread your application, and it might be a good idea to request a review from peers or ask someone who's unfamiliar with the project to read it to make sure it makes sense to them. And then another good tip is to start early and break the writing into pieces, also utilizing checklists and timelines to help you keep track of the writing process is really helpful as well. When it comes to more specific tips regarding proposal components, of course, you want to follow the RFA and what they recommend, but in most grants, you want to make sure that you're providing a clear problem statement. So you want to describe the specific cancer screening problem in your community, and if possible, use local data to support your need. You want to make sure you have well-defined goals and objectives, and we're going to talk more about how to do that later in this training. And you want to plan feasible and impactful activities. So you want to make sure you're describing what you will do and how, and that the activities match the problem and are also achievable within your grant timeline and budget. Then you want to describe any strategic partnerships to demonstrate reach, trust, and long-term sustainability. And if you're describing a long-standing partnership, make sure to share any examples of how you've worked together in the past. And lastly, include an evaluation and sustainability plan where you talk about how you'll measure your success and focus on simple, meaningful metrics. And then it's always nice to see a little bit about what the plans might be for after the grant ends and how you might sustain the project. So now moving on to the sections of the RFA. The first one is the project overview, where they'll ask you for your cancer focus and your population. For the purposes of this training, I'm going to start with our cancer focus and population predefined, and this will work as our kind of case study as we go throughout the rest of the training. So if you're still working on these components for your own proposal, I'd recommend using the data sources that we're going to discuss in the upcoming slides to help you narrow down your focus. But for today, our focus will be colorectal cancer screening, and our population will be adults eligible for screening in Chatham County, North Carolina. In your proposal, it's also important to include any experience working in this community if possible. So then the next big section of the RFA is the background and significance, where you'll explain why your population is a priority or why the problem you want to address is a priority for that population, and document that with data, and also describe how input from your community partners guided your focus. So there are 3 steps that I like to take when collecting data for background and significance sections. First, you want to review existing data. This will help you determine the current screening rates and identify factors that are contributing to those rates. Secondly, you want to collect new data if necessary. So you do this both to update existing data as well as gather data that's more specific to your local population and fill in any gaps in the existing data. And then the third step is done throughout all of these steps, but you want to always make sure you're engaging your partners, especially in collecting data. From them, you might be able to collect local data, and you also want to be identifying their priorities throughout this process too, as their priorities are like a data point that you want to gather. So let's start out talking a little bit more about reviewing existing data. So in order to explain the significance of the problem, you'll need to review existing county level data. In our case, we're going to search for data to assess colorectal cancer incidence and screening rates in Chatham County. And so here are some data sources for you to that can help you in your assessment. I know many of you are in clinics. You probably have access to your own, EHR data for your community. That's obviously a great resource. We've also included a comprehensive list of data sources in a list that we emailed out this morning. So next I'm going to talk a little more about the State Cancer Profiles website and how you might use this to find screening rates. So the State Cancer Profile website is also linked on your resource list. From this page, we're going to want to select North Carolina from the drop-down list, and that will take you to the next page where you can browse state-level cancer data. So after you select incidence up here once incidence is selected, you can look down the list until you find colon and rectum cancer. Now pay attention to this because I'm going to give you some time to practice this after I go through it. So here I can see that the North Carolina incidence rate is a little bit lower than the national rate. And to get to the county level data, I'm going to click on this map. Oh, there, I'm going to click on the map symbol. That takes me to this page where I can select the data I want to see on my map by county. Under the group, I want to make sure to select screening and risk factors. For the topic, I will select colorectal cancer screening. And for the screening risk factors, I'll make sure to select guidance sufficient CRC, ages 50 to 75. And once you've chosen your data options, you can click Generate Map. That will take you to a map that shows those screening rates. I want to note a few things. These are screening rates based on modeling, so they might not be perfectly accurate. So if you have access to more specific local data at your clinic level, that's going to be more helpful for you. But this can give you a kind of a broader, bigger picture. Another thing I want to mention is that it's using data from when the recommended age for screening was starting at 50. It's now 45. So, sometimes our existing data isn't perfect, and that's exactly why we also need to collect new data. So once I get to this map, I can hover over Chatham County in this case, and I can see the screening rate is 77.4, which is way up in the dark green. So that's not too bad for Chatham County. Okay, now we're going to take maybe 10 minutes or so for you to try this on your own. So I can put this link in the chat and go ahead and explore the State Cancer Profiles site and see if you can follow those instructions to find the colorectal cancer screening rate in your county. And once you find it, just share it in the chat. So let me try to find that link for you. Okay, great question in the chat. We have multiple counties that we serve. Are there any limitations on region for this grant opportunity? I would say the only limitation for this grant opportunity is that you need to serve somewhere in North Carolina. And so it doesn't matter if it's one or multiple counties. You might also be working in other states as long as you're also working in North Carolina. Mhm. Oh, we've got our first one in the chat. The for Mecklenburg County, it's 34 out of 100,000. And now make sure too you're finding the screening rate and not the incidence rate. I know that can be a little confusing because we talked about both of them a little bit.
Mary, can you hear me?
I can.
Yes, hi, this is Devonda. I'm sorry, someone came in my office while you were giving these instructions. So I am on the North Carolina incident report. How is it now that I find my county?
Yeah. One way is to click on, is this the page that you see right now? The quick profiles for North Carolina?
It is.
If you click on this map, it'll take you to the next page where you can sort the data options to find the screening rate by county.
Oh, okay, thank you so
Yeah,
much.
yeah, and then just make sure that they match what I have on the screen there.
Okay.
Okay, for Dare County, screening and risk factors, 66.6%. Okay, we've got Robeson County at 58%. Rowan County, 40.5. Okay, Forsyth County, 71. Good job. Let me know if anyone's having trouble or have any questions. Where is the map? Okay, Sonia, did you get to the first website? You're in the profile? Okay. So from the quick profile, if you click on the little map symbol next to on the colon and rectum line, okay, it should take you to this next page where you can change the data here, the data fields, and then click generate map. So to find screening rate, Marilee, you want to make sure that the data group says screening and risk factors, the topic says colorectal cancer screening. Okay, Sonia got it. And then guidance sufficient CRCs, so that will include all guidance recommended tests, and then press generate the map. Did that help, Marilee?
So when I do the generate the map, it doesn't have all of those, it doesn't have all those questions. It seems like it has less number of questions. I don't know. Maybe I did something wrong. One, all the same screens on here. I keep clicking back, but maybe I did something wrong. Do that part again.
Yeah. Well, I do have quite a bit to cover, but I'm absolutely happy to stay on after to help you walk through it if you'd like.
Okay, thanks.
No problem. Okay, I think we're going to move on. I see that some of you were able to find your rates. So after you've determined your screening rate, the next step will be to conduct some more research looking into what might be contributing to low screening rates in your county. If they're low, they may not be low. You can do this by reviewing literature and existing data and collecting new data, as well as gathering community partner input and creating your own maps and diagrams of your current processes. So as you investigate factors that might be affecting your rates, you want to pay attention to where they might fit on this fancy model called the social ecological model. Mapping factors back to these levels can help you understand the dynamic interrelations between the different factors that you might find, and it can help you think through ways that you can implement an evidence-based intervention that can target these contributing factors on each level. So let's brainstorm together for colorectal cancer screening. What might be some different barriers, and where might those barriers kind of fit on this map? So like, what are individual level barriers for screening? What are more community or an environment level or policy level barriers? Any ideas? And feel free. Yeah, okay, we've got fear of the procedure. Yeah, that's a great individual level barrier. Yeah, any others? Add them to the chat. Transportation, you can come off mute too if you'd like. Cost, those are great examples. Okay. So some of the ones that I came up with were lack of health insurance or maybe a lack of a primary care provider. Cost, which you mentioned. Lack of transportation was already mentioned. Maybe the provider at the or interpersonal or organizational level isn't recommending that someone get screened. Language barriers, yeah, we named that one at the same time. Fear or embarrassment was mentioned. Forgetfulness, maybe they just didn't return their fit kit, or they didn't have interpersonal support. So there could be many more, but this just shows how thinking about the different levels of this model can help make sure that you're covering all your bases. And then these different barriers are things that your intervention may actually be able to target. So another resource that you can use to search for contributing factors at the county level is called the County Health Rankings and Roadmaps website, also linked on your handout. From the home page under the health data, you want to click on health data by location. And we're not going to practice this one together today. I'm just going to kind of walk you through it. But then that next page will take you to the map of the US, and you can either click on your state or you can search for your state or county in this text box here. If you type in your county, it'll take you to the overall health outcome rank for, in this case, Chatham County. As you can see here, it's ranked pretty healthy among the counties in North Carolina. Good job, Chatham County. To quickly identify possible factors, you can scroll down on that page and it'll take you to the Chatham County Community Conditions, and you can select Show Areas to Explore and Show Areas of Strength. And then that'll take you to a lot of different factors. And by highlighting the areas of strength and areas to focus, it'll show you in the pink color some areas of strength, and in the red color some areas to explore. So here I can quickly see there are 2 areas to explore that might be somewhat related to cancer screening. Those include the uninsured and some income inequality. And then some areas of strength that we could potentially leverage for colorectal cancer screening are that people are getting their flu vaccinations. So it's good that there's a high prevalence of uptake of health activities, and maybe the cancer screening kit could be paired with flu vaccinations. Primary care physicians are in abundance, as well as preventable hospital stays. So we're seeing some positives that we could leverage as well as some areas to explore. So now the next step, we're going to talk a little bit more about collecting new data, and we're going to kind of also talk about engaging your partners at the same time, because in my example, we're going to be collecting new data from our partners. So these steps are kind of combined in this case. So we've discussed reviewing existing data. You'll also want to collect new data, and this could be in the form of a lot of different, you can use a lot of different methods to do this. You might do interviews or focus groups, surveys, public meetings, or direct observation. You want to make sure that you're working with your community partners throughout the whole process as they have in-depth knowledge, of your local context. I'm going to talk a little bit more about interviews today, but I'm not talking about an interview in like a complex research context, but more as a structured meeting, as a way that you can gather data in a structured way while having maybe a more informal meeting with your partners. So as I've said often, it's important to engage our partners. Potential community partners may be all kinds of different people. They may be healthcare systems and hospital partners. You may be the healthcare system. I know we have a lot of clinic partners on today. You might have partnerships with other providers, staff. Your patients are your partners, specialists, government agency partners, academic or faith-based organization related partners. Who are some partners that you know that you'll be working with? Feel free to share them in the chat. Or you can come off mute too. Local health department, that's a great one. Anyone else have one? Community centers, good. Okay, thank you for those examples. So let's say for our case study, you decide that you're going to interview clinic staff, and you're doing that in order to identify their priorities and understand contributing factors to the screening rates. So first you want to determine what you need to know. You'll want to kind of come up with an overarching question that is the question that you want to answer throughout the interviews. So here are some possible questions, like, is colorectal cancer screening a current priority for the clinic? And then next, you want to write out the actual interview questions that you will ask to find the answer to your overarching question. So we'll talk a little bit about how to do that. And before we do that, I just want to go over a few things to try to avoid when you're writing your questions. One type of question we want to avoid when possible is a yes/no question or a close-ended question, as they often get close-ended responses that don't go much deeper than maybe a one-word answer, like yes or no. These questions can work sometimes if you follow up with a probe, like say if you say, do you have a provider champion? And they say yes, you might follow up with, okay, well, can you tell me more about that? If you plan your conversation like that, then it's okay to use close-ended questions a little bit. Why questions are another to try to avoid. They can kind of just sound confrontational, or they might imply that there's a right or wrong answer. So it's best to avoid them. Most why questions can easily be reworded. For example, instead of asking a clinician, why are your rates so low? You might ask them, what do you think is impacting your current rates? And then that's also a more open-ended question, and you'll get more interesting answers. Leading questions should also be avoided because they may lead people down a path of fixed response options and suggest the answer that you want. They also tend to be a little bit assumptive. For example, if you ask, how satisfied are you with your rates? It may lead them to say that they're more satisfied than they would have been if you simply asked, how do you feel about your current rates? Like, they may not have been satisfied, but they didn't, think about it until you ask the question that way. And then double-barreled questions, these are essentially two questions in one. So if you ask them like, what do you feel about your screening rates and what are you going to do to fix them? Like that's two questions in one, and that can sometimes confuse your respondent and they might only answer part of your question. And when you're going back to analyze and look at your notes, you might not know which part of the question they were answering. So it's just best to ask those questions separately and not as one question. So now we're going to do another little activity here in our group. I have 3 different interview questions here that all have room for improvement. Looking at this first question, why are your screening rates low? What's wrong with that question and how might we make it better? And while you're thinking on that, there's a question in the chat. Is gathering new data a requirement of this funding opportunity or more of a suggestion or recommendation? Okay, good question. So in the background and significance section of the funding opportunity, we're going to be looking for data that backs up your need. And so whether you have that data already or it's data that you need to collect to tell your story, that's going to vary depending on your situation and context. If you need to collect new data to answer your question and to write that section, these are some things that you can do to do that. But it's not a requirement that you collect new data. It's more a requirement that you back up your proposal with data. I hope that makes sense. Okay. So why questions put people on the defense? Yes. So the first one's a why question. Good. How about the second one? Do you have a colorectal cancer screening champion at your clinic? And Kelly, are you asking for the request for proposals?
Yes, I received, good afternoon. I received the email from you with the 4 documents and it has interview, it's just different documents, but is there one document that says, here's the application template, here's the LOI template, here are the questions that you need to respond to for both the LOI and the application? Because with the attachments, I'm just not sure what I'm supposed to do with all these attachments. I just need.
We have not sent the RFA yet. It hasn't been published yet. You can expect to get that at the next week after the last session. What I'm covering today will be a lot of these sections will be in the RFA. And I'm sorry about the overwhelming attachments. Those are just accompanying material for this training that you can use and save and keep if you want to, if they're helpful for you, but certainly not required for the application. Okay, so for the second one, we've got an answer from Lynn. It's a yes/no question, and maybe instead we can ask if you have a CRC screening champion at your clinic and who are they and what is their background. Okay, yeah. That's still a little bit of a yes/no question, but asking them to talk a little bit more about what their background is, you'll get a little bit more information. That's good. Okay, the last one. Describe your pre and post visit screening processes. What's wrong with that one? Anyone else have an answer for that one? Okay, it's 2 questions. Great, Marilee. Yep. The processes might be very different, so you will probably want to ask those separately instead of together. Okay, now I'm going to talk a little bit about how you might summarize all the information you get from an interview like this. One helpful way is to create a table where in the first column you'll write the interview questions, and in the next column you'll write a brief summary. And when you're writing the summary, all you have to do is use bullet points for complete thoughts. You might include some notes like the question wasn't asked or the question wasn't answered. And then anyone reading it should get a sense for what was said, and when helpful, you can also add quotes. So here's just a very brief example. Like I said, that doesn't have to be full sentences, just complete thoughts. So tell me about your clinic's current priorities. Maybe they said HPV vaccinations and CRC screening. Tell me about colorectal cancer screening initiatives at your clinic. They said they want to join a QI collaborative to improve their rates. So this is just a little tool you can use to make notes, either during the interview or afterwards using like a recording or a transcript if you want. And I say interview, but these can just be simple meetings. I want to make sure to remind people of that. And I did send out a PDF of the slide deck ahead of this meeting. I can send everything out again after this call. So after conducting the interviews with clinic partners, you can say for our case study, you included that improving fit tracking is a priority and transportation is currently a barrier for patients. So you and your team and a group of partners hold a meeting to further discuss what you've learned. And so now we're going to talk a little bit about partnerships. In the RFA, we're going to ask you to define any partners that will support your project, your program, and describe their role in providing any outreach or cancer screening or follow-up. And if the proposed project is dependent on partner involvement, we also want to see their commitment demonstrated with a letter of support. So I'm going to talk a little bit about a letter of support in the next few slides too. So first, why do partnerships matter? They're a great way to strengthen your application's credibility and your capacity. They can help demonstrate community trust and relevance, and they also enhance feasibility and sustainability of your work when you work together with others. So some tips for the proposal and your partnerships. You'll want to identify each partner and their relationship to your organization in what you write in the proposal. And you'll want to specify their roles and contributions to the proposed project. And importantly, if they're a newer partner, this is fine. But if they're a longstanding partner and you have a history of collaboration and shared goals, you'll also want to describe that in the proposal. So some tips for letters of support. A good tip is to actually draft the letters for your partners to review and personalize if they want and sign them. So instead of asking them to write it for you, it's always good to start with a draft. You'll want to include specific details about the partner's role and commitment, as well as your past experience working together. And these can be kind of written. It's funny to write them because you're writing them as if the partner is writing them. So they might say like, I, Jane Doe, have worked with, Piedmont Health Services for 10 years, so you kind of write it from their perspective. You'll, if it's available, you'll want to request that they put it on formal letterhead and use clear contact information in the signature line. We're not so picky about this for this proposal, but some grants might be, and it's a good practice. You'll also want to make sure that the letters are aligning with what you have in the rest of the proposal. And of course, make sure you give your partners plenty of time and context to respond to the letters. Okay, now I'm going to talk a little bit about evidence-based interventions. This is something we'll cover more in depth with funded participants, but I want to give you a little bit of information because especially for the Tier 2 applicants, we're going to want you to describe an EBI that you've selected and why that EBI is the best for your cancer screening needs in your community. So hopefully this will help you a little bit in that process. So what do we mean by an intervention? Interventions can be programs, practices, principles, procedures, policies, pills, and products, a little bit of a tongue twister, that are intended to improve health-related outcomes. So some steps to finding an EBI. The first step is to search for systematic reviews. These are broad recommendations for intervention approaches that are effective. The second step is to look for what we call packaged interventions. which are more specific interventions that often come with protocols and other resources that will help you support implementation and delivery. And many of these package interventions are going to be using one or more of the approaches that you might find in step one. So like in step one, if you find like provider recommendations as a large approach that works for cancer screening, you might find an intervention that gives you guidance and materials to implement provider recommendations. Then this third step is to search peer-reviewed literature to fill in any gaps and report and to find more information about it, whether or not the EBI has been used in your settings. So some places to find systematic review recommendations include PubMed, going straight to the literature. The community guide is a great one that's really nicely summarizes systematic reviews, what works for health, and the Cochrane collaboration also have systematic review findings. These should all be linked on one of the PDFs that I emailed this morning. Those package interventions with all the more specific materials, the best one that I would recommend is Evidence-Based Cancer Control Program site put on by the National Cancer Institute. SAMHSA may have some, and if you're focusing on HPV, I'd recommend the hpviq.org website. As you're looking through these websites, and looking at EBIs, you want to also assess them. You want to assess them for evidence that they're effective at improving the targeted population, and that they have potential for implementation in real-world practice, and that they are actually going to fit with your population and setting. So let's talk a little more about effectiveness. So we're just going to kind of touch on this at a broad level right now, but these are 5 different categories that fall under effectiveness. The first looks at the methods that were used to test the intervention or to review the intervention studies. The second, you want to look at the number of studies that were testing the intervention and the consistency of the findings across those studies. A lot of this information is summarized on those websites that I linked earlier. The third is the magnitude of effects. So you not only want to know if the intervention was effective, but also how much was it effective? You know, did it increase screening rates by just a small amount, or was it a large increase? Because that might help you decide between different interventions. And then you want to look at the effectiveness across subpopulations. And you're particularly concerned with looking at whether the intervention has been effective in the populations that are most at risk for the health problem that you're finding. And you also want to see if there's evidence of effectiveness in a population like the one you're working with. And if not, there's ways that we can talk about adapting interventions, which we'll cover in one of the post-award trainings. And then lastly, you want to look and see how current the findings are. So going back to our 3 steps for assessment, you also want to look into potential for implementation in real-world settings. So by this, I mean that in addition to be effective, our interventions actually need to work and reach our people, and they need to be adopted by providers and practice settings. They need to actually be implemented with fidelity, or in other words, as designed, and we want them to be maintained over time. Like once our grant funding runs out, we want it to keep going. So these are all criteria for assessing potential for implementation. They're part of this framework called REAIM. I have the website there if you're interested in learning more about that framework, but good things to think about when looking for EBIs. And then lastly, you want to look at how well the EBI, the evidence-based intervention, fits with your population and setting. So in considering fit, you take all the information that you gathered during your assessment and you compare the different EBIs in terms of how well they fit with your context. So starting with your health problem, does the EBI address that problem? Does it address your goal? How about, does it fit with your priority population or setting? Or was it tested in a totally different setting? There's also a list of factors that you want to consider. So those are those factors that are contributing to a problem that you were looking into during your assessment. As you try to understand the factors that contribute to the problem, you'll want to see how whether or not the EBIs you're looking at address those. So if it's low screening rates, do you have additional data that helps you understand why they're low? If it's due to factors at the patient level, what are those factors? Do patients not understand the importance of screening? Are they unable to find transportation? And so you'll want to look for EBIs that, as much as possible, directly target those factors that you identified as the ones contributing to the problem. And lastly, you want to make sure that the interventions resource requirements fit with the resources that you have available and are within the scope of the proposal, for example, that you're applying for. Does it fit with the staffing and other resources that you have? So in summary, when selecting evidence-based interventions, it's a balance between selecting ones that are that have strong evidence but for effectiveness, but also are likely to fit with your setting. So how much evidence is there to support the effectiveness of the EBI? How much evidence is there to support the EBI's potential for implementation in real-world settings? And how well does it fit with our problem, population, and setting? So then the last bit that I want to talk about today are our SMART objectives. So the RFA will ask you to write 3 to 5 specific, measurable, attainable, relevant, and time-based objectives that your project intends to accomplish over the funding period. From all the data that you've collected, you can start to establish your aims and objectives. And when thinking about it, you might want to ask yourself, like, which demographics have the lowest colorectal cancer screening rates? Maybe that's where you'll want to focus. Or what factors are contributing to the screening rates, and which ones are most important and most changeable? What resources are available? Have you gathered input from your population and your community partners? What factors are a priority for your community partners? And does the objective address the needs of different populations and seek to address cancer screening disparities? So from all the data you've collected, you can start to prioritize which factors you want to address. So here are some methods that you can use to prioritize factors with your team and your partners. The first is called nominal group technique, where you would brainstorm to generate a list of ideas and then anonymously rank them. The second is multi-voting, where you would go through multiple rounds of voting to narrow down a long list. And the third is strategy grids, which is like a matrix with scores for 2 criteria, like need or impact, as well as feasibility or changeability. So we can practice one together. So in our case study, we've identified from looking at existing data that income inequality and high uninsured rate are potentially factors contributing to our problem. And then from our case study interviews, we identified that some barriers are difficulty tracking fit kits at the clinic level and lack of transportation to complete screening. So one might put these factors onto a strategy grid like this and start to think about how feasible or changeable each one of these barriers might be to address, as well as how impactful, or like what the need is, how impactful would they be if you focus on those factors. So looking at income inequality, I would say the feasibility is medium to low because it may require policy changes or lower cost services, which might be hard for us to do with a small pilot grant. However, the need is high because income inequality can lead to lower screening rates due to cost and other issues like that. It was also an area for improvement in our case study county. The uninsured category is similar. It's something that we probably are not going to be able to easily change with a small pilot grant, but it would also have a high impact. When it comes to fit tracking, I thought this one would maybe be pretty feasible because this is something where we can actually impact change with a small pilot. It might require changes to workflows or a new tracking system. Maybe that's something we can actually work on. And as far as need, I also thought that would be high as it directly impacts the ability to screen more patients. Transportation, I said medium. That one's a little trickier. There are interventions designed to help with that when it comes to colorectal cancer screening, like mailing fit kits to people. And then for need, I said high because that also directly impacts patients' ability to be screened. So those are the two areas where in our case study, I'd maybe recommend focusing on with a pilot grant like this. So once you have kind of identified your priority areas, you can start to use all that to develop your SMART aims and objectives. These objectives should be specific, measurable, attainable, relevant, and time-bound. And so I'll talk a little bit now about what each of those mean in more depth. So by specific, we want to know, does the objective state the outcome that you aim to accomplish? And does it also mention what population and by when and by how much? So you want to, include all of that detail in your objective. So that's where we get the specific from. We also want them to be measurable. So how will you track your progress and know when milestones have been reached and the objective achieved? The objectives should be attainable. So ask yourself, is the objective challenging but achievable within the capabilities of your program and the community being served, and do you have the resources for that objective? As far as the relevance, is the objective aligned with the priorities of your program and your funding requirements? Is it meaningful to the population and the community of focus? And then lastly, when we're considering a time-bound objective, we want to know, is there a deadline to achieve the objective? And are there review points also to assess progress? So here's one that we can work on together. I have this goal here that says increase screening rates. It's not very smart right now. What are some things we could do to make it a little smarter? Not everybody all at the same time. Come on. Okay, got one. Make it measurable. When will the goals be achieved? Yep. Any other tips? State who, when, how. Yep, that's great. On my next slide, I have some examples. So you might change it to something like, we will create and implement a new fit tracking system in 2 Chatham County clinics within the next 6 months. Oh, this one I forgot to change the date. But to address transportation barriers, we will implement a colorectal cancer screening mailed fit intervention in 1 Chatham County clinic by December 2024. So hopefully they made that objective. Or by December 2025, Chatham County colorectal cancer screening rates will increase by 10%. So you can see the SMART goals are naming timeframes, they're naming how much something is increasing, they're naming what's changing, what the problem, what we're addressing, where. So it gives you a lot more detail or specificity. Now here on the last slide is an example of SMART objectives that someone submitted previously as part of their proposal for these community pilot grants. And this applicant was awarded funding. So I wanted to share this on the last slide as an example for you all to see how someone else wrote their objectives. You can kind of use it as a guide to help you think through yours. And in the next part 2 training, here I can bring you to the training overview slide. We've covered part 1, so now next week we'll talk about part 2. And I have a lot more examples to share from that sample grant in part 2 as we talk about the project plan, evaluation plan, and all of that. So make sure to join us next week for more detail like that. And then, just a reminder of the funding opportunity. We'll get the RFA out to you, I hope, by next week, and the letters of intent are due at the end of the month. And then before you go in the last 4 minutes, please complete the post-eval survey. I'll also try to get it out to you by email this afternoon as well. But it's very short. It's very similar to the one you took in the beginning. Let me put it in the chat too. And I can take any questions. I can stay after too if anyone wants to work on any of the activities with me. But thanks everyone.
So, Mary, thank you for the wonderful presentation. Of course, I'm biased, but there were a couple of folks in the chat who mentioned that too. I do want to say to everyone, and also to you, Mary, because it's hot off the press. I will be able to send the RFA off later, if not today, tomorrow, prior to the next session.
That's great. Thank you, Veronica.
Okay.
Well, thanks everyone. If you don't have questions, you're free to go once you've completed the post-evaluation. But yeah, let me know if you have questions and I'll stay on for a little bit.
Hello, Mary.
Yes, hello.
Hi, this is Devonda. I just wanted to get, I guess, an idea of, I know we haven't gone through everything yet, and I'm kind of trying to wrap my head around what exactly this project will look like, but about how much time do you think is involved in preparing this?
In preparing the application?
Yes, is what we are supposed to do, is it just an application or are there other parts to it?
Yeah, I guess it'll probably make more sense once Veronica sends around the request for application with instructions.
Okay.
But it's a grant proposal, so it'll kind of, if I bring my slide back to the overview of my training, um, it it's going to ask you to write like a small paragraph for your background and significance, where you've got like the data that's talking about your problem and why it's important to work on. You'll want to, name any evidence-based interventions that you've picked, or talk about your plan for identifying ones if you're funded. You'll want to state, your clear goals that we talked about, and then a little bit more about your plan. Like once you get funded, what are you going to do with the money? How are you going to evaluate your work? And then a small budget at the end that talks about how you'll spend the money and what resources you might have to help kind of supplement it. So I guess, how long are the applications usually lengthwise, Veronica?
Yeah, thank you so much for that, Mary. So these are not like an NIH application at all. But we do need pertinent information to help us make decisions. So that's why Mary is going through the different sections as she provides the trainings or the information sharing between today and next week. But the applications are max 5 pages. And it's with these things that Mary is talking about in terms of the background, the timeline, evaluation, your goals, your partners, and really the purpose of these, overall, the purpose of this funding opportunity is around a screening evidence-based intervention. So what's your name?
Devonda,
Yolanda or Evonda? I'm sorry.
Devonda with
Oh,
a,
Devonda. Thank you. And I apologize for missing
oh,
that.
no, you're fine.
So what we're looking at is whether you're part of a community-based organization or part of a clinic. We want to make sure there is some clinical aspect to it, because the main part is we want to get folks screened. So if you are affiliated with a community-based organization and you're considering tier 1, I'm not sure if that's specified with what we've talked about so far, but tier 1, the max you can apply for is $10,000.
Mhm.
Over that year, if you're with a community-based organization, you'll want to, again, do some of the things that Mary's talked about in terms of looking at your data, what are the problems, but also see what clinical site or clinical setting that you would like to partner with. So it's both exploring what the problems are, but exploring what evidence-based interventions you want to consider, and who are you going to partner with to make sure that folks are screened. So that's what a tier 1 is. A tier 2, folks already have their partnerships, they have that connection with the clinical site, or it's just a clinical site itself, and they're ready to implement an evidence-based intervention to get their community and their patients screened, and they will have a max of $20,000. So going back to what your